Hi, my name is Camille. Welcome to my podcast exploring the coronavirus's effects on El Salvador. Let's begin. As of the first week of December, El Salvador reported 40,000 total cases to date and just over 1,000 deaths. With a population of 6.4 million, that would mean less than 1% of the population has had the coronavirus, and would suggest, compared to at least half of Latin America, El Salvador has effectively mitigated the spread of COVID-19. Like myself, many independent foreign thinkers, such as foreignpolicy.org and the Associated Press, are suggesting that President Bukele may be misreporting the nation's COVID cases. Whether intentional or not, it is true that these numbers very likely do not represent the actual number of cases, as many areas of El Salvador do not have access to testing kits. Therefore, we will not use the number reported by Salvadoran health officials as a metric to indicate their current prosperity in the face of the pandemic. Instead, much of the information used to construct my podcast today has been provided by NGOs like Doctors Without Borders or IGOs like the United Nations. To understand the repercussions of the pandemic, one must understand the many situations that existed before the pandemic that have only been exacerbated in the past 9 months by issues such as environmental crises, lack of government support, and a lack of primary care. While NGOs may have reported a gradual decrease in homicide rates over the past decade, I believe these rates will soon rise again. And this is because I understand that in the absence of social services, economic opportunity, and political representation, the gangs have provided and will provide the support that people need from their government. In the past, the government's few expenditures, as well as their unproductive providership role towards citizens, was already funneling men into gangs. Also, considering that many young men are already often arbitrarily arrested on suspicion of being gang-affiliated, and that Bukele has mandated anyone who break his lockdown rules be arrested, those desperate enough for financial reprieve may very well jeopardize a future where they may pursue a dignified life in El Salvador, should they be branded criminals for trying to subsist during the pandemic. So now, let's begin our conversation by talking about the mounting pressure Salvadorans are facing. Unfortunately, El Salvador is extremely susceptible to environmental hazards. In late May, right before the first case of coronavirus was reported, Tropical Storm Amanda caused over $200 million in damages. This destruction largely affected rural communities, with many homes washed away and farmlands destroyed. On top of this, a plague of locusts at the beginning of the pandemic created widespread food shortages and contributed to many people relying much more heavily on the government for aid. At the time, Bukele's administration reported that the army had been mobilized to deliver food packages to every, quote, hamlet, shack, and house. Though the crisis began long before the first case of COVID in El Salvador was reported, over the course of the pandemic, the severity of the water crisis has also become much more visible. Due to government-led deforestation and storms like Tropical Storm Maria preceding the pandemic, the majority of natural water sources are polluted, and a large portion of the nation's land has become unsuitable for food production. Currently, more than 600,000 people in El Salvador do not have access to any type of drinking water or sanitation service, and more than 1 million people have access to inadequate water service and are unable even to collect rainwater. Thus, on top of the COVID pandemic, we understand that many people are in need of basic amenities such as access to potable water, something that they might normally have been able to purchase. However, with the break in their income, this is no longer possible. So, let's add this to our list of pressures that have been augmented as a result of COVID-19. Food insecurity, too, contributes to a vicious cycle of poverty and health problems like diabetes, anxiety, or anemia, which require maintenance. Maintenance requires money, and right now, even with money, because of COVID, many do not have access to their health care. Speaking on one quotidian effect of such insecurity, a man from Sonsonate reported that his family adopted a simple survival tactic: sleeping on mattresses filled with beans, corn, or any extra food they have. I cannot fathom the feeling they must have, to have to sleep on the things that will keep them alive, to rest essentially with one eye open for fear of theft and consequent starvation. It is my understanding that measures like these, though psychologically draining, must be taken by many Salvadorans. As we learned in our course, there is an inherent distrust shared amongst the people, which has come as a result of decades of conflict, violence, and government failures. In Patricia Madriaga's Matan y Matan y Uno Sigue Ahí, she explains individuals in these contexts feel pressure not to trust anyone at all because they all understand that any person in a difficult situation, going hungry, or with a wife that is pregnant, will do what they must to meet the demands of survival. Thus, especially in the context we have already established of drought, ill health, and shortage, it is understandable that amidst the COVID crisis, Salvadorans will not be as concerned with one another as they must be for themselves. So, let us add this to our list of reasons we are concerned about a post-pandemic crime boom. You may be asking, how has the Salvadoran government responded to help its people? In March, El Salvador suspended primary healthcare services, causing an increase in deaths unrelated to COVID infection. Compared to the first half of 2019, deaths from metabolic disorders, respiratory illness, and heart problems increased by 400%. Researchers attributed this to several things. First, the stigma or fear of contagion that causes many people to delay seeking medical assistance. Second, to the fact that many vulnerable populations are not receiving primary care or are expected to use telemedicine without access to the appropriate technology. Or, thirdly, to the fact that those who do need to go to the hospital via ambulance are dying before being admitted because care workers need authorization from the public health system before patients may be moved to a care center. Though not a consequence of violent conflict, let us add poor health management to our list of reasons Salvadorans have been needlessly dying since March. Unfortunately, the nation has a long history of not investing its funds into public resources. It has been largely the responsibility of international organizations to aid Salvadorans before, during, and likely after this health crisis. According to the UN Office for the Coordination of Humanitarian Affairs, the United States Agency for International Development is expanding screening, public health education, and telehealth services in El Salvador. NGOs like AmeriCares have been responsible for infection prevention training, installing hand-washing stations, distributing soap, or constructing medical clinics to serve low-income or marginalized communities. In March, Bukele announced measures to support the economy in El Salvador that many believed should be a model for other larger countries. When he shut down shops, schools, and public transport, it was proposed to be for 30 days, but instead lasted until mid-June. During this time, non-essential workers were only permitted to leave their house twice a week to go to grocery stores. According to a study done by the London School of Economics on 1,600 Salvadorans, 80% reported that they had to stop economic activity during this lockdown. That means a majority of Salvadorans went 3 months without any source of income. Without any income, they would not have had the means to buy themselves food on their permitted outings. In an attempt to ameliorate the pressures this shutdown placed on citizens, Bukele announced payment on basic services such as water or electricity would be suspended for the 3 months. He also promised that hundreds of thousands of people would receive a bonus of $300 to compensate for their lack of income during the crisis. Unfortunately, myself and many others see a problem with this. First of all, the population of El Salvador is over 6.4 million. And millions, not thousands, were clearly affected by the economic shutdown. So, Bukele pledged to a plan that would only aid a small fraction of the citizens. Secondly, as of late September, the average living wage of a typical Salvadoran household was $325 per month. $300 to last 3 months? I have no comment. True to his word, only 40% of respondents reported receiving these bonuses, and a vast majority of the recipients were formal workers. Understand that across the country, 60% of the labor force works in the informal sector, and likely these people most need aid to purchase potable water or food. So, not only did Bukele do little to aid the vast majority of his people, he also ensured that there was no way for many workers to try to access money. Bukele also bypassed Congress to mandate that the police arrest anyone breaking his shutdown rules. 1 week after the lockdown was lifted, almost 60% of the respondents still reported no economic activity. So, add financial hardships to the list of hardships a majority of Salvadorans are now facing. Rightfully so, economists are fearful of the consequences of Bukele's actions on the nation's post-pandemic economy. What happens when strict lockdowns halt the economy and few checks are distributed? Or when the welfare state cannot absorb economic disruptions and marginalized populations already suffer from poor health, food and water shortage, and limited healthcare access? Bukele's meager economic incentives to the people are not reflective of the money the nation had at its disposal. El Salvador has received billions of dollars in grants and loans, yet many, like Salvadoran digital newspaper El Faro, have criticized the Minister of Finance for not clarifying the allocation of these loans. The former president of the Central Reserve Bank released a report rejecting President Bukele's claims that the government had no money to face the pandemic with, and, in fact, revealed that federal banks have been the main benefactors of these loans, not citizens. Emblematic of a bigger problem, the man was asked the next day to step down. Often, in Latin America, criticisms of regimes are not tolerated, especially from those with institutional power. In the future, this situation will likely affect foreign investment into El Salvador, as corporations do not often invest in economies with questionable transparency. It is important to understand that the government's current expansionary fiscal policy is a response to economic problems caused by the pandemic. The pandemic hit El Salvador at a time when the level of public debt was also already very high. Taking loans from outside the country have made banks more vulnerable to failure and put the nation closer to recession. Currently, the debt-to-GDP rate is close to 90%. Moreover, injecting money into the economy without labor is untenable over the long term, as it creates inflation. But we already know that they have been doing this over the long term. So, with inflation, money will lose value and things will become more expensive. Demand will drop as people cannot afford as much. Then, the economy will shrink, causing people to turn more to the informal economy and crimes. And this is because, as prices rise, the Salvadorans continue to feel the pressures from our list. The demand for cheap stolen goods like medicine, for example, will grow. Considering that supply and demand power the movements of neoliberal organizations like the Maras, violent crime rates are likely going to increase as transactions in the informal economy also increase. Now, let's talk a little more specifically about a way all that is happening now is going to translate to the future. Let's consider children. Losing jobs, livelihoods, and salaries has created high anxiety levels in homes, which UNICEF has connected to increasing rates of violence against children and women since March. As I learned from the course, particularly for favela rising, access to education can be one of the most effective ways to deter young people from turning to the informal crime economy. While students are now on their summer vacations, half of their previous school year, and for the next, education is entirely online, causing them to spend more time in these potentially unstable spaces. Also, many children do not have access to the necessary technology for this measure. With this added impediment to education and the turmoil being generated in homes, I believe socioeconomic mobility will be increasingly hard for these disadvantaged children. It is particularly children from these marginalized communities who most need education and a sense of security to be able to see that they have options beyond the Maras. If such pressures on Salvadoran youth continue, I have learned that very likely they will turn to the Maras for a sense of identity, family, protection, money, or social legitimacy. That is why I'm concerned that children of this pandemic are at increased risk of not only forming the next generation of mareros, but many of them. The endemic poverty faced by the peoples has already led to the destruction of many families. From my research, I have come to understand the predominance of the gangs in El Salvador as a response to these broken homes, poverty, capitalism, weak democratic and social institutions, and an absence of security. Considering that social precarity also drives the hyper-violent masculinities, and we have constructed a list to add to the pre-existing precarity, it will not surprise me if there is a spike in gang recruitment after the pandemic passes. Because of COVID, more families will be broken, more children will be uneducated, and the hardships of subsistence will increase. Because of this, we will soon see how Maras will continue to hold their necro power, if not increase it. Considering that much of the conflict observed in El Salvador before the pandemic was a result of the unmet needs of the people, I think it is justified to be concerned about the additional shortcomings we have observed during these past 9 months. Evidently, the COVID pandemic has added stressors to a nation which has already been demonstrating its distress through high levels of criminality. It is my hope that we may all recognize now that the problems the Salvadoran people face are much deeper than a vaccine will fix.